Good afternoon, everyone. Welcome to the Silence Equals Violence Network webinar, Empowering People with Disabilities to Recognize and Report Abuse. We're here to talk about a serious issue affecting people with disabilities. To make this webinar accessible, we are presenting using plain language. The presenters will describe graphs and images that are included on each slide. As you know, the webinar is being captioned. At the end of the webinar, there is a resource page with links and publications to learn more. It's important to note that some of this information may be difficult to hear, and for some people may trigger an event. If you experience the need to talk to someone, please call a trusted family member or friend or the National Domestic Violence Hotline at 800-799-SAFE, S-A-F-E. And if you are experiencing an emergency, please call 911. Description: there are 3 logos on this webinar page. One of the Silence Equals Violence logo, one for the California Foundation for Independent Living Centers, and one for the Board Resource Center. Next, please. My name is Teresa Favuzzi. I'm the Executive Director of the California Foundation for Independent Living Centers, and I would like to introduce Molly and Kecia.
Hi, I'm Molly, and I'm a longtime advocate for people with disabilities. And for about the past 4 years, I've been focusing on abuse of people with disabilities, how to create greater awareness and increase prevention. Thank you.
Kecia?
Hi, I'm Kecia Weller, and I'm glad to be here today and share what I've learned as a disability rights advocate about abuse, violence, and prevention. Next slide, please. For the next hour, we are going to be talking about abuse awareness, how often people with disabilities experience abuse, reporting abuse, tips for successful interaction with law enforcement, and ways everyone can educate their community. Next slide, please.
So before we get into the details and data, we want to frame this around human rights. And human rights are for all of us. As some of you might know, a few years ago, many nations came together to create a new treaty called the Convention on the Rights of People with Disabilities. This has not been ratified by the United States at this point, but we are using it as a standard in our work to prevent abuse to address the rights of people with disabilities. One of the most important articles in the treaty is number 16, which discusses reducing abuse of people with disabilities. And basically what this is saying is people with disabilities have the right to be free from exploitation, violence, and abuse. We believe being free from abuse is a human right that all people share. The description up top is the logo of the United Nations. Next slide, please. Part of how we got here is from a group working together that in October brought 18 agencies representing state, national, aging, abuse prevention agencies that came together last month to discuss how to increase awareness of abuse of people with disabilities. this group is going to meet again in early December. Next June, the group hopes to participate in the California Adult Abuse Prevention Month, where we would focus on a campaign to bring greater awareness statewide on abuse of people with disabilities and seniors. At the top of the page is the logo of the Silent Epidemic Network. Next slide, please.
Abuse happens. Anyone can be exposed to abuse at any time. We, people with disabilities, are victimized at a higher rate than non-disabled members of society.
Important that people with disabilities are team members anytime professionals provide abuse awareness training in the community. As we all know, in the disability community, the phrase "nothing about us without us," and this includes bringing awareness of abuse and prevention. Description: a graph that shows people with disabilities are experiencing abuse at a higher level than people without disabilities. Next slide.
Abuse is a way to gain and maintain power over another person. People can feel very low about themselves. When it happened to me, I felt powerless. I felt trapped in the situation. I'm sure others feel the same way or similar. When abuse happens often, the person learns it's easier to give up. Emotions are pushed down and you end up feeling worse. It becomes an endless spiral, a ball of feelings in your gut that seems to hang around like an angry cloud. Abuse can be subtle, like calling a person bad words like, "You don't know anything." We all know overt abuse is dangerous, like hitting another person, stealing from them, or breaking their adaptive equipment. Description: 2 photos. A woman holding her head in distress. A man holding his head down in sadness. Next slide, please.
So abuse of people with disabilities is an epidemic because many people with disabilities experience one type or another of assault or violence. We call it a silent epidemic because it is too difficult to talk about and not talked about as a policy issue. But we see this also as a call to action. The webinar today is just one step in talking about this issue, what abuse is, what it feels like, and some reason why it's happening to so many people with disabilities. A few reasons why this happens is, number one, people with disabilities are seen as defenseless. Many people think if you have a disability, you can't protect yourself, and that you won't tell what's going on or if you're being abused. The other barrier that is part of why it's such an epidemic is that many people with disability rely on others for support, and when you rely on other people and people who you don't know well at times, it can lead to more risk of abuse. Description: picture of a man sitting in a wheelchair, person standing over man, grabbing and pointing. Next slide, please.
Data shows that people with disabilities most likely know their offender. In the old days, we were taught to be afraid of strangers, sometimes called stranger danger. We now know most abuse, assault, and violence happens from people we know. Molly will show the data in a few minutes. People with disabilities report crime less often. Many have not been taught what abuse is and put up with unsafe relationships. Many are told not to tell anyone. And if they do, they will be hurt even more. So they continue suffering. They don't know that there are many people wanting to help. Often a disability can make it difficult to report crimes. I'll be sharing my stories in a few minutes. Even if someone reports, investigation is often delayed, thinking we could be making up the story. This is important since many people still attend a program. If the abuse is found out, it can be treated as an employment issue or staff person and not reported. If the person is fired, they can go to another program or be someone else's caregiver, and the cycle continues. Next slide, please.
So now I'm going to talk a bit about data that surrounds the abuse of people with disabilities. The first data point I want to share is a 2012 national survey where more than 70% of adults with disabilities has experienced abuse at some point in their life. Description graph, light blue shows that 70% of people with disabilities who reported they have experienced abuse. Next slide. This slide talks about who is the abuser. This also shows that over 75% of people with disabilities who report they've been abused know their abuser. These include acquaintances such as people from programs, non-family caregivers, people from the community, and other connections to them. The other 34% are people who are unknown to the person. Description, a circle graph that shows the percentage of each category. Next slide, please. This shows data from the Bureau of Justice report that came out in 2015. This data was reported in 2013 and shows that 50% of violence happens to those with multiple disabilities. Of that group, 68% were raped and or sexually assaulted, 56% aggravated assault, which is the attempt to cause serious injuries, 50% with simple assault, and this is when a person feels danger with contact will happen, and 30% are robberies. These rates are way too high, but there has shown a reduction from the prior year. Description. Chart showing the percentage in 4 colors. Next slide, please. When it comes to children, a large number of children with disabilities experience abuse. 1 in 4 with a disability have experienced abuse. Of that quarter who've been abused, 25% are physically abused, and 14% are sexually abused. Description. Top graph shows that 25% of children with disabilities are abused. Second graph shows percent of physical versus sexual abuse. Next slide, please. This is another graph from the Department of Justice from 2013. This data really brings home why this is an epidemic, because people with disabilities are 3 times higher to be abused in some way than people without disabilities. The Justice Department reported this assaults, which is the graph on the bottom, that these assaults have doubled from 2009 to 2013, which is very alarming. Description. Top graph shows circles that represent people with disabilities are 3 times more abused to the red circle. Bottom graph is a red pillar with an arrow showing the rate increase 57% in 4 years. Next slide, please. Why is this data so high, so alarming? Well, 2 reasons. The first reason is fear. There are many reasons why people with disabilities don't report when they are abused. It's based on fear. Fear they might be threatened more or think they did something to cause the abuse. These people also believe or are told if they report, they will be abused more. Many believe no one will take them seriously and no one will hear them if they said a family member or someone they trust was abusing them. Too many people are also told if you tell, you could lose your home, your services, your care support, and so they don't come forward because they don't want to lose what they need. There are also barriers. Many times people with disabilities are taught to be compliant, which means agree or obey the rules, which makes them easy targets. That they aren't feeling that they can, fight back or tell someone. Compliance is typically something they learn in their childhood, to be rewarded in school if they behave a right way. Another barrier is people don't know they have rights. They don't know if they're abused, that they have a right to speak up, and they don't have to tolerate abuse.
People with disabilities rarely report for individual reasons. The one I spoke about and many more, not reporting allows the abuser to continue in the person's life. If 70% of the cases go unreported, that means many more are unabused than we realize. Description. Graph of dark gray, 70% of those who don't report being abused. Next slide, please. If a person with a disability reports they were abused, there is a small chance it will be prosecuted. People with disabilities are often devalued and considered to be less credible. For example, they're not viewed as a reliable witness in court because typically not provided the appropriate accommodation, they need to give a complete report. Next slide, please. We all know abuse happens. There are many types of abuse. For today, we will talk about the types that abuse happens to people with disabilities. We will describe each and give you examples. Most of us think of abuse, usually think of physical and sexual. Financial abuse happens a lot, even to people living on Social Security with little money. Also, something called emotional intimidation, a type of abuse that you can't see but is very hurtful and dangerous. Molly will talk about this in a few minutes. Description: 3 pictures of women with looks of distress and a photo of a man in handcuffs with a cash in his pocket. Next slide, please. Physical abuse. A person who is physically abused may come to a program, work, school, etc. with unexplained injuries. People who are physically abused may make light of their injuries or hide their injuries. Being physically abused is very painful. It can be hard to talk with people that can help. The person may feel trapped with no way out. Typical signs can be bruises, burns, injuries that are hard for the person to describe how they got them. Description: a woman with a man's hand over her mouth and she's trying to remove it. Next slide, please. Neglect. Neglect happens when a caregiver or other person responsible for taking care of an individual fails to provide food, clothing, medicine, and care. With neglect, you also get emotional abuse because the neglected person feels powerless to do anything to help themselves. Disability. When a person with a disability needs a piece of adaptive equipment to live, someone breaks their adaptive equipment on purpose, it's hard to function. An example is a man with cerebral palsy who needed help to get out of his bed. His caregiver refused to help him get out of his bed to do his daily activities. Eventually, the man got bed sores as a result of the neglect from his caregiver. Description: photo of a broken chair on the side on the pavement. Next slide, please. Sexual abuse is when you are being forced to do a sexual activity against your will. You may know the person that does the unwanted advances. This person may use objects on or in your body without your consent. Evidence of abuse can include bruises, scars, or new pain in sexual body areas. These apply to non-consensual activity. Description: photo, woman distressed with hands up in her face. Next slide, please. This is a story of painful events that happens every day to people across the country. Now I'm going to tell you about my own personal story. I live independently, and I have a job since 1992. Last year, when I was coming back from my self-advocacy conference, I was sexually assaulted on a Greyhound bus. I was trapped against a window. I was frozen from fear. I endured a 2-hour bus ride from Bakersfield to Los Angeles. When I got home, I called my parents and told them what happened. Right away, we went to the police station. I was going to make out a report to the police, but being in shock, I found it hard to talk to them. The police, they didn't understand me. They didn't take me seriously. When I was interviewed, it was done in a large, noisy room with lots of people. I wasn't able to get calm and tell them my story. It was intimidating to share my story with strangers looking at me. I was dismissed, and there was no report taken, and nothing came of it. The story happens to many people experiencing assault, then having a bad experience with law enforcement. Description. Upper corner, there's a picture of me. Also, a photo of people on a bus, and the other picture of a woman giving a report to a police officer. Next slide, please.
So I would like to talk about another abuse. It's called emotional abuse. And this abuse is a hidden abuse, but still very critical type of abuse. It's the actions that take away someone's dignity and self-worth. It can happen often to people who are dependent on others for support and care. Some of the examples of this type of abuse is being put down, badgering, isolating, ignoring, bullying, threatening to remove benefits, services, medication, or treatment. Description: a woman sitting on the floor with her hands on her head. There are words surrounding her like loser, leave, shut up. Next slide, please. So I want to share a story where I encountered that. I'm very involved and active in groups. I'm also very expressive, and part of my disability is I talk loud, not knowing my voice can go loud. I was volunteering for a community organization, and as a passionate advocate, I was advocating and asking questions about policies that were being developed. They didn't like that I was asking questions, and when my voice got loud, they thought I was threatening them, even though I wasn't. They filed a abuse report thinking I would get nervous and quit. I did not. I was investigated, and after the investigation, I received a letter saying that I did nothing wrong. So again, this is intimidation and people not understanding how to work with people with disabilities, and there needing to be greater training and awareness of how to work with people with disabilities. Photo. Me on top in the left corner. The other photo is two women at a conference table, one woman looking abrasive and one pointing using her pen. Next slide, please.
Financial abuse. This type of abuse happens frequently. It can start with small amounts and get higher. Financial abuse means taking advantage of a person's money. Sometimes we think of financial abuse as happening to people with lots of money, but it happens to people who live on Social Security too. At times, people will push us to give or loan money when we don't have any to spare. Ways it happens: steal money. You think you lost money from your wallet. Credit cards are another way. Using the credit card and bringing it back. The person doesn't realize money was taken until their bill arrives. It can also slip by if a support person helps pay the bills. Forcing person to use ATM card, or buying a gift or lending money and not paying it back. Telling the person they support they're not paid a lot. Play on sympathy. Description. Person wearing handcuffs and money hanging out their back pocket. Next slide, please. Now I'm going to tell you another story that happened to me about my financial abuse story. A few years ago, I had a support person who took money from me using my ATM card. It started when she wanted to borrow money, and over time that amount increased. I was told by the worker not to tell anybody, because if I did, I could lose my regional center services. Finally, it ended up with the person keeping my ATM card and knowing my PIN. I didn't know when my money was taken. The total amount was $200. It stopped when I had my annual IPV meeting with my social worker, and I started to cry. I shared that I felt bad because the worker was using my ATM card. I was scared to tell someone because I would lose my personal services. I needed to stay independent. The social worker got my bank records and investigated. The person was fired from the agency where she had worked, and the money returned back to me. Many of us experience subtle abuse like this and don't tell anybody out of fear. Since that time, I have a trusted person in my life that I share everything with, and I do not keep secrets. Description. A photo of me in the top left corner and a photo of a person taking cash from the ATM. Next slide, please.
So we've given you an overview of the data and the significant data numbers that show how often abuse happens. We've also talked about the type of abuse. I'm now going to give you suggestions on how you, people you work with, can prevent abuse. The first is creating a safety plan. It's easier to prevent abuse if you have a plan. The first step to creating it is having a conversation, even though it's difficult. Part of these conversations is to identify warning signs of abuse, how to report and who to report to when being abused or knowing someone else is abused, talking openly about personal safety, including boundaries, saying no, wanted, and unwanted touch. Also, when creating a plan, it's good to include emergency contact in your cell phone, identifying a trusted person, joining advocacy and social groups, being an active member of the community. Description. Person completing a safety plan. Next slide, please. Law enforcement. Usually when you report to the law enforcement many times. Very few law enforcement are trained to interact with people with disabilities, and they don't understand accommodations and how to provide them. People with disabilities need a compassionate response to their experience, like everyone else who reports that they've been sexually assaulted or abused. As noted in Kecia's story, it is very painful when a person makes a report and it is dismissed because they're misunderstood by either law enforcement or APS, the people taking the report. Sometimes incorrect attitudes are barriers to getting the report correctly filed and for justice to occur. This again is due to lack of training, information, and skills that are a barrier. For the past couple of years, I've had the fortune of being able to train law enforcement. It helps when I train law enforcement that they understand the people with disabilities from first-hand experience. When I'm an equal partner in a training. Description: law enforcement officers in the first picture. Second photo of an empty courtroom. Next slide, please. Again, even though you go to law enforcement or whatever reporting authority, it's very good to know your rights. Making a report is very stressful, and for you to do it the most effective way, you need to know what accommodation you need so you provide information with less anxiety. Some of the accommodations are plenty of time to tell your story, interviewed by someone who uses understandable words, meeting one-on-one with someone in a private, safe place where there are few distractions. Of course, there's other accommodations people might need, and they need to identify them to whoever they are reporting to. Having an ID card that identifies other needs or accommodations that will be helpful will help law enforcement be aware. It takes courage to go and report at a police station, APS, wherever. Unfortunately, when you heard Kecia talk about her experience, we see that people with disabilities do not have a good experience. It's critical that a person with disability have a good support system, like a trusted person when they are making a report. Description: law enforcement badge. Next slide, please. Reporting. This is also for people if you see someone who is being abused and you report it. Some of the things that you should mention if you are contacting Adult Protective Services or other safe agencies to make a report. When you do report, you are protected from liability, meaning when you do report, you cannot get in trouble. Okay? What you need to know, or what is helpful when you do report, is sharing what your concerns are, what you've seen or heard as abusive behavior. If the person has medical issues, and what kind of support that person has. It is critical for people to remember that if they are reporting someone that's being abused, it is not their job to prove they're being abused. They just have to report what they see. Next slide, please.
Mandated reporters. Mandated reporters are any persons who have full or occasional responsibility for care or custody of an elder or dependent adult. Are you a mandated reporter? It's critical that you understand your responsibilities. If you're not sure, one thing you can do as a result of this webinar is to clarify your role when someone describes abuse to you or when you suspect abuse. Mandated reporters include social workers, licensed staff or care professionals, health practitioners, in-home support service workers, adult protective service employees, services, and employees of long-term health facilities, as well as law enforcement. Report if a person reports abuse or an incident is observed, or there's an unexplained injury where abuse is suspected. Next slide. When to report. Verbal report immediately or as soon as practical, and follow up with a written report within 2 days. Who makes the report? The person who has direct knowledge. And what type of abuse should be reported? Well, everything we've talked about so far today: physical, sexual, financial, neglect, abandonment, abduction, any treatment that results in harm, pain, or mental suffering. Next slide. Whew, wow, I want to take a deep breath. I don't know about any of you, but it's time to talk about community awareness. There are many ways that we can play a role to increase community awareness. One way is to join efforts in your community to get the word out in June, which is Elder Abuse, Adult Abuse Prevention Month. The Silence Equals Violence Network plans to join these efforts and to include messaging about the significant abuse issues of people with disabilities as well as elders. You can track policy issues, educate and propose solutions to your local elected officials, and you can join or create an abuse awareness coalition or task force that brings together organizations to make change. Description: image of people in front of a state house. Next slide. We're really encouraging all of you to make a difference, and our call to action is to join groups, educate law enforcement, encourage reporting, train care providers, and advocate for better laws, and understand what role you play in this larger picture. Description: image of many raised hands. Next slide.
So lastly, we want to leave you with some resources. These are just a few. There are many, many resources about abuse, data about abuse, but what we want to share, just a few, and again there are many of them, is places first that you would call if you are being abused or you know someone being abused. Of course, 911 if you're in immediate danger or you need help right away. The crisis tech line, the National Domestic Violence Helpline,
Adult Protective Services at each county has an agency. You can connect with the Department of Developmental Services, the National Center on Criminal Justice and Disability, Disability Rights California, and other disability rights organizations around the country. We also, there's a public service video that we encourage you to look at called Abuse of People with Disabilities, a Silent Epidemic, and the California Family and Domestic Violence Referral Directory. Next slide.
You can reach Molly at brc.org. That's her email address. To wrap up, I'd like to emphasize abuse is never the fault of the person being abused. Listen, observe, and report. And raise your voice to stop abuse. And I'm Kecia, and my email address is Kecia, Kecia, at brc.org. We're about finished with our presentation. I want to remind everyone that our public service announcement video is on YouTube. Many advocacy groups and programs use the video to have discussions about ways people with disabilities can reach out to their communities to put a stop to abuse. Description, photo of Molly and Kecia. Next slide, please.
So now's the time for questions and answers.
What do you advise when someone was told to call the nurse if they had a problem with the aides in the hospital, but then the aides took the nurse call button anyway?
I would suggest that when the person, well, first of all, if the person has someone who visits them, to request their help in asking for the nursing supervisor and to talk directly to the nursing supervisor. But also I would, when the person actually gets the call button, eventually, hopefully, the person will get the call button and ask to talk to the nursing supervisor. Definitely report that because it's a significant abuse issue. Are there any other questions? I see that Lauren also said inappropriate use of restraint, seclusion, aversion interventions, which are ineffective at modifying behavior and experienced as trauma. Absolutely, totally agree. Good point, and thank you for saying it. Hector said it can be harder for some men to report abuse and to be taken seriously when reporting abuse. Absolutely. I want to thank everyone for joining us. If you'd like to learn more about Silence Equals Violence Network, you can contact Molly, Kecia, myself, this is Teresa at cfilc.org, or Mark at brcenter.org. Thank you for participating today in this webinar, and we encourage you to lead on. Let's find ways to work together to stop abuse. Thank you.